Hi, my name is Jessica Gardner, and I am a resident physician at Cincinnati Children's. Being a resident physician means that at the hospital, what I'm responsible for is the day-to-day care of patients. And that means making decisions about how to move forward with making them well or keeping them well. And the resident part of that means that I have a supervising physician who's done with all of their schooling and all of their training, who is there to help me make those decisions and to support me should I need any help in any other way. By far, the best two parts of my job are, number one, getting to work with patients and their families. I think particularly when you're going into something like pediatrics, where the people you're caring for, so children, aren't making a lot of their own medical decisions and aren't alone in being responsible for their care. You have to be comfortable and excited to work in a team, because that's what it is. When you're working as a doctor with a team, which is a patient's family and the patient themselves, that is the thing I'm usually most excited about in a day, because it's all the more people who are going to be helping to make that individual patient well and to make their family well so that they can go home. So that's thing number one by far, is getting to work in that kind of group setting. The second thing that I love, and particularly working at Cincinnati Children's, is the people that I get to work with, so my colleagues. I think that when you have a job like being a physician, and particularly being a resident physician, where your hours can be pretty long, the thing that is the most helpful and the thing that really helps you enjoy your job even more is working in a supportive environment and getting to share both the hard parts of the day and the successes of the day with people who are going through the same things. And for me, I get to work with an amazing team of fellow residents and attendings and nurses and other staff who are just absolutely amazing, and we are all geared towards one goal, and that's helping patients and families get well and be able to live their best and most high quality life outside of the hospital. My identity from a societal level became much more impactful in what I decided to do coming out of residency, which is that I plan to go into general pediatrics. Part of why I pursued that is that I love that exact interaction of being able to walk into a room with a family and having them be surprised in a pleasant way because they actually have a physician that looks like them, which seems like a very small thing when it's not something that you've experienced, but actually it's a very big thing. Feeling secure that someone's not going to make negative stereotypes about you and use those negative stereotypes in the way that they approach you, in the way that they talk about your care and make decisions about your care. And that is something that I actually have even sometimes received active feedback about from families. And that's really huge, is them having that sense of security and that sense of safety, because that needs to be there in order to build a relationship with families that allows you to take part in their care. Any pain? Can I just touch? No. Okay. Any pain on this side? No. One of the things I've enjoyed most about working at Cincinnati Children's is, yes, it's this, gigantic health institution where there are all these moving parts, but at the end of the day, I know that a part of my training, and to any extent that I would like, if I want to do more time in these environments and in these spaces, I can be a part of helping to address those barriers of care, those gaps in care, and those just straight up inequalities. Being able to go through the gigantic hurdle of making it to the visit in the first place, and knowing that once they make it to the visit, they will have access to the care and to the resources they need, which includes both direct medicine, be that me listening to their heart and their lungs and prescribing medications, or be that all the things that are related to and feed into health. So that would be things like nutrition. That would be things like making sure they actually have a pharmacy they can walk across the street to, even if they don't have one directly in their neighborhood. All of those things I know that I can give them through my work here. I think that's the biggest way that each of us, by being a part of this institution, are able to provide families through whatever way we are contributing to the institution of Cincinnati Children's. The difference between, I think, what people think we do and what we actually do in a day is that feeling. I think that the day's a lot more chaotic than I think people maybe realize when they think about what doctors and nurses do. But I think what sticks with us the most is those interactions with patients and families, and those are the things that we take away and that warm our hearts when we're busy and overwhelmed and tired. And so I think that sometimes families don't realize, and patients don't realize how much they are our fuel sometimes. All that you can do is put your best foot forward and to have your heart in the right place from a compassion and empathy standpoint, and to go from there. My name is Jessica Gardner, and I am a resident physician at Cincinnati Children's.